Uh, Welcome to the National Foundation of Swallowing Disorders webinar series, Meet the Makers. I'm Ed Steger, President of the Foundation. Our goal with this series is to offer our community access to those who have innovative and creative products specifically for people with swallowing disorders. The series is not meant to be promotional or informational. We want to give you the opportunity to ask the creators of these products your question. Learn more about how these products help people with swallowing difficulties and make connections so that your voices feel heard and understood among industry partners. Thank you for joining us this evening, and hope that you find these series to be helpful. Thank you to you who made a donation with your registration. It is only with your financial support of our community that we continue to further our mission. The makers in this series are volunteering their time to share this information. They have not been paid to participate in this series, nor was it required that they be a past or current financial sponsor, although many of them are. If you have participated in the NFLSC webinar previously, you're likely familiar with her system. You will be muted throughout the presentation, but are encouraged to ask questions at any point during the presentation. There is 30 minutes reserved on this call for questions, so please don't be shy about asking. We will record the presentation and make it available on the website within the next day. No OHSUs are provided. You will receive a certificate of participation following the broadcast. Tonight's maker, Dr. Reva Barewal, is kindly offering a raffle prize. One attendee will be randomly selected at the end of the broadcast and must be in attendance to win. All attendees will receive a discount code following tonight's broadcast if interested in purchasing the product.
Ed, this is Elizabeth. I hate to interrupt you, but your connection is just a little bit choppy. I was wondering if I could just take over with the next slide or two. Would that be okay with you?
Yes, that would be fine. Thank you.
Sounds good. I hope you can hear me okay. I'm sorry that Ed's connection was a little choppy there, but we'll pick up where we left off here. I just wanted to provide a reminder that tonight's broadcast is for informational and educational purposes. Both the NFOSD and tonight's speaker do not intend to substitute for professional medical advice, diagnosis, or treatment. If you need any assistance identifying a swallowing specialist, please reach out to us via email. I'd now like to welcome Dr. Reva Barewal. Reva is a prosthodontist with over 20 years of experience in working in private practice with adults and children requiring oral reconstruction. She is also a clinical assistant professor in the Department of Pulmonology and Critical Care at the Oregon Health and Science University. More recently, using her background as a French culinary chef, she created a dissolvable, functional food for people with dysphagia. She is now the founder of Savorease Therapeutic Foods, designed for people on a puree diet to experience crunchy textures and delicious savory foods. Reva has been involved in research and development of evidence proving how functional foods for dysphagia can improve nutrition, quality of life, and safety. 2 studies recently received global awards for her innovation in research. Her interest lies in improving the lives of people with dysphagia using nutritious foods that stimulate the senses and help with recovery. And with that, I would love to turn this over. Reva, if you would like to turn on your camera and unmute yourself. We'll take just a few seconds here to transition the presentation mode over to you here.
Okay. And do you have my screen share?
Yes, you should see a pop-up here.
Does it say show and I just press play, or?
Yes, yep, if you press that play button, it should prompt you.
The fun of dual screens, I think.
Yes, I can see your slide. That looks good.
Okay. Perfect. Perfect. Thank you so much. Thank you all for coming. I am thrilled to be kicking off the Meet the Makers series. I think it's a great idea. Thank you, Ed and Elizabeth and NFOSD. I would like to say this talk is really geared to understanding the why behind the product, the what, and the who. So I've given other presentations at NFOSD that were more research focused, but I hope this talk gives you a real insight on how this food innovation can impact people with chewing and swallowing disorders. At the end of the talk is the fun for me because I want to hear from you, and I'm so excited that we have a Q&A session so we can start a discussion. And that's where the good stuff is. And also the good stuff is the raffle and sharing with you new product resources that are available starting literally today, just a few hours ago. So I'm excited that NFOSD is launching that effort. We will announce the lucky winner. I think Elizabeth is in charge of that. I titled the presentation, Advancing Therapy and Nutrition for Chewing and Swallowing Disorders. So as Elizabeth said, my name is Reva Barewal, and just a little bit about me. My career decision to be a prosthodontist focused on oral reconstruction was a long time in the making. When I was born in India, my jaw was crushed with forceps delivery, and I spent my childhood and teen years in and out of surgery, in and out of research centers and universities, with real experience understanding how being on a soft diet affects you on so many levels. I dealt with issues related to my smile and my confidence in my smile, how I chewed, the constant jaw pain, and how it affected me during my developmental years from an emotional and physical side. So if we fast forward to being a prosthodontist, I have never been the type of person to sit still. So I've always been doing a bunch of things. That's who I am. I've been a researcher, a clinician, and an educator. But I always had a passion for food and nutrition. And somewhere in between dental school and residency, I went to French culinary school and became a French culinary chef. So if we fast track to 2013, I then decided to become a food innovator and develop the first plant-based, highly dissolvable finger food made specifically for dysphagia, and switched my research focus from dental implants to studying dissolvable solid foods, and founded Savorease Therapeutic Foods. But you might be like, okay, what made that shift from being a full-time private practitioner and a teacher, right? So I taught dentists on the side on dental implants, to being a food innovator. And I can tell you that really it was my experience with Jan, one of my patients, that really started me on this journey. So Jan's story essentially changed my life. A little bit about Jan, and she's happy that I'm disclosing this. Jan was someone that had head and neck cancer, and I, in my job, would be the person in charge of oral reconstruction post treatment. So when she was in remission and even pre-treatment. So there was a lot to be done to redevelop function for her. But this kind of treatment doesn't happen overnight. Typically, I'm with a patient for 6 months to 2 years, and I really get to know them. And Jan was super special, and she shared with me her journey with dysphagia, and from the acute phase of treatment, and she has chronic dysphagia. And I want to share some of her words with you right now.
But I tried the oral or the shakes and different things like that that were on the market. I wanted something that I could bite, something I could, that was like real food. But I tried the oral or the shake. But I tried the oral or.
That happened to me before too. Sorry about that. So the topics that I really wanted to talk about kind of are like the seed that I planted there with Jan is really, I want to talk about the issues related to food texture and describe the purpose behind Savorease and the research evidence. I'm just going to go over very in general terms and indications for use, followed by the Q&A. So we just look at dysphagia or swallowing disorders prevalence, and we can see that these numbers represent the percentage of people with these conditions that would have swallowing difficulty in their journey with that condition. And it is quite amazing how much it impacts our society today. And really what I have grown to become passionate about is sharing the word of dysphagia and making it more into our mainstream culture, that people need to know about this condition. And when I look at it from my food lens, I was, I really think this information is very important to know that up to 39% of people with swallowing disorders are at risk for malnutrition. And, that's a staggering statistic, because when you think about malnutrition and it's disease related or associated malnutrition, which is what I'm talking about, it impacts health outcomes, surgical outcomes, quality of life, even length of life. So malnutrition can impact rehospitalization and even length of stay in hospitals. So it is a very serious condition that impacts many people with dysphagia. And so when I look into the causes behind malnutrition, we see, really what are the multitude of issues surrounding the modified texture diet. And I'm using puree here as a photographic example. But what I want to share with you is that I'm going to talk a little bit more detail of some of these things, but we have reduced stimulation. Those 5 senses are not being stimulated with puree as they are with regular foods. And in adults, in food culinary, we get a home run when we hit all 5 senses, right? And we optimize all 5 senses. That leads to food joy. So we can safely say that all 5 senses are not being stimulated in the same extent with puree. There's flavor uniformity and actually not very many choices with puree textures. Using your spoon is what I mean when I say requires cutlery. That is very different from the many finger foods we enjoy with a regular diet and impacts us. And I'll talk about that as well. So when we look at the between meal available ready-made foods, what we see is there is a high sugar prevalence to these foods. And what I mean by that is we're looking at shakes and puddings and ice creams and things like that. There is high sugar. Now, there is a reason for that, and it has to do with the processing. But when I look at my dry mouth patients, I get very worried with high sugar because not only will it cause rampant decay and tooth loss, but it increases bacterial counts in the mouth that are pathogenic bacteria, bad bacteria that will colonize, right? And if we have someone who's at risk for aspiration, then we really need to know what kind of foods they're eating and what can we do to reduce that colonization in their mouth. Not just the thing that we think about, which is brushing teeth or reducing the flora once they're formed. How about we reduce the flora from forming in the first place? So dysgeusia and anosmia are like loss of sense of taste or sense of smell. When you have puree foods, you blenderize that food. That means those aromatics go into the air and they're not retained in the food. That's why it is so hard to get that flavor profile, that intensity of flavor profile with puree food as you can get with regular foods. And so if someone has dysgeusia or anosmia, then there is oftentimes a risk of them not being able to taste their puree meal at all. When we look at texture sensitivity, safety, what I'm talking about here is, you know, the risks involved with preparation of foods, not having enough ready-made foods to make it easy, but even in food service, Texture Safety and IDDSI, International Dysphagia Diet Standardization Initiative, is a way to try to measure that. But it is a concern with getting that texture just right for a patient. And patients oftentimes have concerns with fear of choking. The nutrient density studies, several studies have shown that puree food tends to be lower in nutritional profile than regular foods. And of course, the visual appeal and the texture anxiety and fear and frustration are often components of the emotional response to patients that have dysphagia. So my question was, could there be a food that addresses these critical issues and is a functional food that can provide oral exercise and support therapy goals? And so it was with this question and working with a team of people, including Jan and geriatricians and SLPs, RDs, food scientists, culinary chefs for 2 years. It was that kind of team collaboration that led to the development of Savorease Therapeutic Foods. And the difference that Savorease has brought to the table, if you will, is that it's the first truly dissolvable solid. So, you know, this concept of crunchy nutrition, something you can bite into, as Jan said, is really the difference here. It's not a soft bite. It is not a really hard bite, but it provides that sense, that audible crunch. And it dissolves so quickly in the mouth, and it dissolves to a puree state. So this product was created. It's not like what you would see in the grocery store where things are not, if you go down the aisles, you can see some more dissolvable solids. They're made for the general population. This product was geared towards people with chewing and swallowing disorders. So we took input from SLPs, dietitians, and people with dysphagia in order to create the product. So there was a lot of science behind it, and we felt that we needed to do clinical evidence trials to prove different outcomes with the product. The fun of this product is that it comes in 5 delicious flavors. So making it really delicious was something that we were really proud of. And so, you know, we asked what people are missing. People wanted popcorn, so we made popcorn that was dissolvable. People wanted to cheese it again, so we made vegan cheese. We like to have the vegetal flavors. This is great for children that are learning to eat solids and using our products for feeding skill development to gain taste for savory flavors, helps to build that palate for regular solids. The urban spice was my answer to anosmia and agousia. Could I, or children that need more stimulation. This product has like these intensity of garlic and herbs and onion smells in that urban spice, which people with anosmia and agousia have a better chance of smelling their food and tasting their food. The other component was the critical nutrition delivery. In each bag, we have 3 grams of protein, 2 grams of fiber, and 130 calories for the adult portion. And the child portion is half that size. So if you look at these crisps, they're feather light. So a bag basically has 23 grams of product in it. And we packed nutrition into essentially a foam. The technique is extremely sensitive and labor intensive, but what we're able to achieve is giving real food nutrition in every bite. It's plant-based, gluten-free, with no sugar required because it tastes so great on its own. The clinical research that we've done is focused on 4 critical areas: safety and diagnostics, quality of life, nutrition, and therapy. So actually, one of our safety and diagnostics study, the one that was presented at DRS in 2022, Dysphagia Research Society in 2022, won the Michael Donovan Innovation Award for Revolutionary Translational Research in Dysphagia. And the winner was the first author, Samantha Schoon. And that award was presented by NFOSD. This year, we're excited to be at DRS. Valentina Mochetti is going to be presenting a poster with a FEES protocol using the product. And what was really amazing with the study done by Schoon and Bruno was that they showed that in following MBSIMP component scores, that there was no difference between the behavior of puree and the Savorease crisps. Now, the FEES protocol is very similar, but it actually looks at it. Of course, the FEES is a very different way of looking at an instrumental study and using the VASIS protocol as well. So if you are at DRS, this is a great study to take a look at. And I will be there too with a booth, and I believe NFOSD will be there. Quality of life studies, nutrition, therapy, these are all important components and critical in our understanding of how these dissolvable solids can impact a patient in many different ways. But when we talk to people that have been exposed and experienced a product, providers are saying it brings a savory product and a snack type product to the market. It fills a gap. We have no finger foods on a soft diet. This is a treat. I love it. Most patients, those on puree, have no other texture than smooth and sloppy. Being solid but safe for puree is amazing. The patients and caregivers, a 5-year-old said, it's like magic. There's a caregiver who's looking after her mother, and she said, you can't only eat one, you have to eat the whole bag. Another person said, my husband has trouble with swallowing food and has dropped to 114 pounds in the past year. Savorease crisps allows him to get healthy, needed nutrition, which is easy to ingest, and he likes them. I'm the sole caregiver, and after more than 4 decades of marriage, I can finally win an argument when it comes to getting him to eat. So when we think about where does Savorease fit when it comes to categories of food or product categories? And unfortunately, there are a lot of product categories that this fits into, and there's different language and definitions. but I want to share with you that, you know, there are products, many products that would fit transitional food or fit a dissolvable solid but not be a transitional food, right? Or be a first finger food but not be a transitional food. What I can tell you is that Savorease fits all these criteria. It can be used in therapy, can help advance therapy, advance texture. It can be used, it is a true transitional food. It does dissolve using the fork pressure test to puree. It's considered a dissolvable solid, a true meltable. It can be a first finger food for a child. You know, it really fits that transition from puree to solids, and it is an important developmental step. And it's called a crisp meltable. So when we talk about sensory stimulation, I mentioned that before. I love this diagram because it really shows where Savorease Therapeutic Foods fits. When we look at puree and mixed puree, we can see the five senses over top: auditory, what they hear, what they smell, the tactile. Indirect touch means using a spoon. Direct touch means using your fingers. We tend to eat more with direct touch, so it's an important component of eating. Visual, color, shape, complexity. What does it look like? How do we break that down as far as visual appeal? And the taste, primary and secondary. You get with a solid primary taste, that first taste that's in the mouth, and with a lot of solids, you get a secondary taste when it mixes with saliva. You only get a primary taste with puree and mixed puree. It's only when you hit these dissolvable solids that you start getting multiple flavors, and that increases joy. There's more visual appeal. You can touch. Savorease, if you look at the trend from puree to hard solids, Savorease Therapeutic Foods is a solid you can grab with your fingers. And so that is an important component for self-feeding. There's more aromatics to it because of what I said before, and you get that auditory stimulation, which is brain stimulation for that crunch and then dissolve. So here is a great slide where I'm like, well, how versatile is this food? It can be used in main meals, accompanies a meal. You can use it to scoop up your puree so you eat more of your main meal. It can be used in between meals. It can be crushed on top of soup, and believe it or not, it floats. So you get that visual appeal. It won't disintegrate, but as soon as it hits the mouth, it will dissolve. The popcorn lollipops is an excellent example from an SLP of how she uses it in pediatric feeding and therapy. You can take this product and crush it onto a fork and it will stick because it has a cohesive nature. It doesn't particulate in the mouth and it won't particulate on your fork. So you really get that ability to go and have something kind of cohesive and stay in the bolus form and not disperse throughout the mouth. Here I have a picture of a video from someone who has MS for 30 years and now his caregiver has to feed him. Savorease offers him an opportunity to eat on his own again and have that dignity that is so important in eating. So here is the fork pressure test, and what I can say here is basically this is a test with IDDSI, and we can see there that the fork just presses down and the material disintegrates completely after 1 minute in water. And here I'm just going to showcase a yogurt coated product, and you can see that it doesn't break down at all, so it doesn't pass that test. And here, this is where I would position this product. It is truly in the crunchy, dissolvable solid category and plant-based nutrition with no added sugar, which is very different from what is currently out there. If we look at indications, we can see for adults, patient characteristics that this might be helpful for are fatigue and weakness, peg tube weaning, dry mouth, This product can dissolve even in dry mouth situations, and I would encourage you to do food trials with people with dry mouth. Multiple missing teeth, this is a product that breaks down with no chewing required, just sitting on the tongue, and it will break down. The physiologic impairments, esophageal and pharyngeal, if you're working on those impairments, this is a great product to help support your dysphagia therapy. Used in food trials, swallowing exercises, strategies, training, sensory stimulation. Honestly, the best way to use this product is to use it in therapy and use it in daily nutrition. And you will see that oral exercise being done during that meal, and it will complement the dysphagia therapy that's done with the SLP. It's important for you to know that it fits multiple diets. It's not just for people on puree. It does cover puree, minced, moist, and soft and bite-sized. And really, the great thing about being a finger food is a lot of adults are, especially with dementia, we have a grazing behavior, a slow eating, an eating, coming back to it, going kind of not eating concentrated over breakfast, lunch, dinner. This is a great grazing food where they can slow eat throughout the day. If there's eating fatigue, this is perfect. They can, again, it's very easy to eat and can slow eat throughout the day and increase their calories and protein intake. Finally, with quality of life, eating dignity is so important, and self-feeding is a big part of it, so they can eat on their own and build their eating confidence. Socialization, I view that popcorn. I think of long-term care. I think of someone at home, and everyone else in the family is eating popcorn, and they can have popcorn too. So it's inclusivity, socialization, shareable, which is so important. A lot of these things are important for pediatrics as well. If we're looking at tube feed weaning, this has been used. It reduces anxiety. You can try little bits of it and slowly build up their confidence because they can sense that dissolve, and it reduces their worry. It's used in feeding skill development, of bolus control, chewing, motor planning, increased strength. Texture acceptance, you can use it in food chaining, sensory stimulation, texture sensitivities, it helps to build confidence. For nutrition, we are doing work with outpatient feeding day programs to show improvement in flavor acceptance, reduction again of anxiety, increased calories and protein, increased food intake, and fits many dietary restrictions because it's dairy-free, gluten-free, it has none of the top 9 allergens. And it helps them learn self-feeding, so working with an occupational therapist and hand grasp. So now we're down to the last minute. This is the question and answer period. I want to let everyone here know that there's free downloads. So these are fresh off the press. They're brochures for caregivers and people with chewing and swallowing issues. And then there's flyers for providers. I mean, caregivers can enjoy both products. Elizabeth has made them available to you. So for your eyes first, we will do the raffle. And I wanted to thank NFOSD, and I've offered a discount code for all the participants. Everyone here today gets 20% off all products if you use the discount code on our website at www.savorease.com. I want to let you know these are the new bags that are coming out. I just love them because it just really brings that joy that is so important, that sense of uplift that I wanted from these products to give people hope and energy. The Crispy Melts for Kids is, of course, a smaller crisp, and it comes in a rod and it comes in a puff. So the rod is for vertical chewing and the puff is for incising, corner of the mouth. And the Crispy Melts there is for the adults, and it comes in 4 delicious flavors for adults. It's a larger size. Currently on the website, you can see crisps for adults and Crispy Melts for kids, and we just changed the language here for these new products that are coming out in March. honestly, if you wanted to be first in line for these new bags that are coming out, if the bag appearance is really something that gets you excited, just put it into the note if you place your order using the code, and we'll hold your order until those bags are ready in March. So that's it from me.
Reva, thank you so much. I appreciate it. I'm going to come join you on camera here. So yep, it looks like there's a plant shooting out of my head. That's me. Hi, everybody. I'm Elizabeth. I'm the executive director for the foundation. I'm going to pop on to start some questions. We have a good list of questions going on here, but before we do that, is now a good time to announce the raffle winner?
I think so.
Okay, let's do it. I have 2 names pulled up here just in case somebody's not present anymore, but the first one, Arwen Jackson. So Arwen, if you are on the call and you are interested in receiving the raffle prize, feel free to put your name in the questions box and your email, and we'll get that sent to you.
Yay, Arwen.
Arwen's still on the call. So.
Oh no.
We will work on arranging that. Yep, I think I see him here. So yes, let me start with some questions here for you. The first one I have is asking a little bit about how to describe the crunchiness of the crisps. Is there a food that you can compare it to, like a Cheerio or something like that?
That's a great question. So it is truly a novel texture. So Elizabeth, I think you've tried it as well, right? And I have heard it is a crunch, but it has a soft, like, mouthfeel even initially. So you can bite into it, but it has this soft mouthfeel. The word velvety has come up as far as that mouthfeel, but you know, I think that it is, someone described it like she can actually feel something in her mouth. She can sense something instead of it just falling flat on her tongue. She really feels that it's there, and that's engagement of those senses is really important. I would say that, you know, are you coming up with anything that resembles that texture in your mind? Because it's truly unique. I just really can't. You know, some things are really hard. It has to do with the processing, and that's why this is so labor intensive. If you look at a Cheeto, or, you know, something that is like that comes like a finger shape, those are extruded, so they are always have a hard exterior. And the problem with that is that when you put it in your mouth, you have to break through the hard exterior to get to the internal core. And that is problematic because that exterior will particulate and won't dissolve. It'll dissolve into small particles. So it's not safe. I would say the sense could be something meltable, like chocolate on something foamy, so that meltable quality is there. But I hope that answers your question, because I could go on and on. I think you need to try it.
Thank you. The next one, it's just a comment. It says, "Yay for vegan cheese." Excited about that flavor. And then I have another one here. How well does it dissolve for patients that have radiation-related xerostomia, and what's the timeline? Do you have the number of seconds it might take for a cracker to dissolve in a dry mouth?
I think that is a fantastic question. And the reason I think it's a great question is that, you know, I have a lot of patients with xerostomia, right? And the variance between patients with xerostomia, the amount of saliva and the quality of that saliva is highly variable. And so when you think of saliva quality as mucoserous, then you can, you know, oftentimes with radiation-induced xerostomia, it turns into a very mucousy type of saliva. And what I can share with you is that in one study that we did, we had patients broken out as to those that were xerostomach. Now, the xerostomach patients were self-diagnosed xerostomia or provider diagnosed, but what we lack in dysphagia, working with the oropharyngeal space, because I know hypopharyngeal, we do have some scoring, but for the oropharyngeal, we don't use a scoring for xerostomia, and I think that's so critical because there's so much variation and it does impact texture and breakdown of texture. But in that study, there was no statistically significant difference between patients that had xerostomia and those that didn't have xerostomia with the dissolve rate. The dissolve rate, in 5 seconds, this product would dissolve in the mouth compared to any other product tested. By 12 seconds in the mouth, no pressure. We're talking no pressure at all, just sitting on the dorsal surface of the tongue. 100% of the product dissolved in all the participants, including xerostomach individuals. So what I would suggest is this. This is a great opportunity for people with xerostomia. It really brings choices to them. I would honestly use it in food trials and really see if this is a good fit for that particular patient.
Excellent. Thank you. Another question here about the size, the diameter of the crisp. Do they all come in the same size, or are there 2 different sizes, multiple sizes?
Great question. So as we manufacture in this huge kitchen that we use a silver dollar, and we say, make it the size of a silver dollar. So if you know, that's about 1 inch. Okay, so that's your diameter on the adult crisp. So they can pick it up with their fingers, right, and self-feed. So if they are in therapy, this is something that they should be able to grasp even if they don't have a good quality grasp. Now, when we think of pediatrics, it has to be much smaller. Now, if you want to use the popcorn, we created an organic shape. So it's not a perfect circle. It's kind of squirrely. It's supposed to give that memory evoking appearance of popcorn, which is imperfect in shape. And it has a beautiful toasting brown yellow to it. Believe it or not, there's parsnips in there and carrots. But in any case, that is more like a quasi-dime shape. The pediatrics, it's the size of a dime. Okay, so that's the puff shape. And that's perfect for getting in between in here or the corner of the mouth. The finger shape one, which is I call a rod, that's perfect for positioning on the molars. If the size is not right for a child, let's say, you can take a piece, you can break it apart, you can roll it in your fingers, you can get it down to the size of a pea and start there. What we're seeing is that kids will take bigger pieces of Savorease compared to existing products that they've used in the past because they know it dissolves so quickly. It's like that child said, it's like magic. So I do have size differentiation based on purpose.
Excellent, thank you. Question about if and when this is available in Canada.
Yes, so what I do is if people email me from Canada, I can work on orders for them. Okay, I don't offer it on the site yet because I don't want a lot of orders from Canada just yet. If there was a facility that wanted to work with me, I would be grateful for that. Right now, we are not at that developmental stage in a business to be able to go to Canada and deal with the exportation of goods and the bilingual packaging and all of that. But I am Canadian and I will take care of my people. So I will get it to Canada. And if you do email me at info@savorease.com, they will direct it to me and I will see what I can do for you.
Excellent. A question here from an SLP asking for some advocacy tips on how they can justify the cost to their healthcare system. So let's say they want to bring this in for trials in the hospital. How do they advocate for that, knowing that, cost is something that they have to factor in?
Yes. So right now we are working with facility pilots. So we have several pilots going on where, what we are doing is we're offering samples to all the providers. So the SLPs get samples, they get the brochures and the flyers, all of that is given to them, and they get cases of the product. So this is wholesale pricing. You will see that on one of the flyers that you can have tonight. You can download. But essentially, that pricing is a reduced pricing for bulk purchases. So you will, as a facility, have the opportunity to have, and it's just, can I be honest, it's just a game of volumes. When you're talking, and I had to learn all this because I'm a clinician, so you have to get volumes at a certain level so you can adjust your price for facilities, and that is truly my goal. And what I really believe is that when we can show advancement of texture in your facility, and we can show improvement in patient satisfaction and quality of life and reduction of risk of malnutrition because they're eating, then I think that is a bigger thing to say than this is just, finger food. It really is a different conversation involving different people within the facility. So if you're interested in facility-based programs that we have, please, again, email at info@savorease.com, and we can see how we can support you.
Wonderful. Thanks, Reva. A question here, a couple similar questions have come in. When the crisps melt in the mouth, once it's melted, what consistency do you call that?
It's puree.
Yeah.
So we've done testing with modified barium swallows and bees and studies, and basically the endpoint texture is the same as puree. So, what we are going to do is suggest that if you are familiar with IDSI testing, you can do this test at home and you'll really see what I mean. It doesn't take a whole minute. The IDSI test is 1 minute in water, and then you do a fork pressure test, and it's really, what does that turn into after 1 minute? And that is supposed to tell you what it turns into in your mouth. But in 30 seconds, in 12 seconds, in 10 seconds, this product will dissolve to a puree. And so you don't need to move it in your mouth. You don't need to press it against the roof of your mouth. It will dissolve.
And a follow-up on that, there is time to manipulate it though, if you want to practice chewing or if you just want to chew.
Yes, that's a great point, Elizabeth. One of the things that people ask me is, it dissolves so quickly, so how do I, and really the point is it's confidence building. It encourages people to take a bite and encourages the muscles of mastication. I can guarantee you the test is put it on the dorsal surface of your tongue and watch it dissolve. But if you give anyone a solid food, including SLPs and RDs and providers, they instantly want to chew because it's our natural reflex. So if you give a patient or a person with a swallowing disorder something that they can pick up with their fingers, they will instantly start engaging those muscles. And that's the value. They engage the muscles even though they don't need to.
Excellent. Thanks. A question about the shelf life of the packages. How long are they shelf stable?
So that's a great question. They are 1 year shelf stable from the time that they're manufactured, which is really wonderful. They are not impacted by heat. Some products would turn into a hard candy with heat. Not the case with this product. It is essentially a product that comes in a resealable bag. I did that on purpose because if you want to maintain freshness, and what I mean, that crunchy texture for that initial crunch that you're looking for, make sure you reseal the bag. Once the bag has been opened, you know, and you reseal it, you're really good about that, I think that you could hold on to that bag for 2 weeks and it would be just fine. If you have a child and you're like, okay, well, I need to make sure I'm now at 3 weeks, I need to make sure, pop one in your mouth, make sure you feel that rapid dissolve, and you're good to go.
Excellent. Thanks. We have a question from a caregiver here wondering if this product has ever been tested with anybody that's had an anoxic brain injury that you know of.
I honestly, a study was done in long-term acute care setting that really involved very complex patients. So that was a long-term acute care hospital, and there was patients with traumatic brain injury in that grouping. So I would hazard a guess that the answer is yes. And we have great descriptions of usage. This is honestly what I see is you will see more of that effect of texture, oral exercise, texture advancement, you know, if you have complex patients and you are using it in conjunction with therapy. If you have a patient at home and they are on a modified texture diet, you're just trying to broaden their experience with foods, it's still perfect for that. But if you're looking to advance texture, you know, I would essentially, my answer is yes.
Excellent. A follow-up on that, a comment from somebody who is on a modified diet. Their comment says they've been on a puree diet since the beginning of January. Knowing that there's a crisp that dissolves into a puree is very exciting. So just think it's nice to hear positive comments like that. Would you recommend this product for adult patients who need to put on weight?
Yeah, so again, I mean, if you, there was that comment that I had on my screen from a person who had experienced it for her husband. And really what we're doing with these facility programs is that patients are at risk for malnutrition. We know that, and weight loss with dysphagia. So the opportunity here is to maintain weight if it's used in a way that encourages eating and slow eating all day. So the whole point of this product is to meet the patient where they're at. Instead of saying you have to eat and you have to eat these 3 meals a day, I want to flip the switch and say, and hope for that patient to want to eat because of all the different characteristics of the food from a sensory perspective. If we flip the switch to want to eat, then we are encouraging more food consumption. And, you know, one of the studies did look at nutrition and comparison of this product to existing products in long-term care. And we did find that we could increase protein intake with this product. So I do think that it's really usage. If you just use it as that food that they can slow eat, meet them where they're at, continue to eat when they want to, use it with a dip, amazing. If they use it with, say, like a ranch dip, it's delicious, or hummus dip that is the right consistency for them. You will just, you know, essentially start a rhythmic activity that is enjoyable, and you will increase consumption.
Thank you. A question here from somebody asking whether you've ever considered offering or marketing this to campers or outdoor enthusiasts who want easy transportation of food, good tasting food to consume their activities.
You know, I've heard everything from that to NASA and space travel. And yes, honestly, I mean, my heart goes out to people with swallowing disorders and feeding, you know, just from my own experience, I really want to help solve that need. But when I think about this food, there's so many opportunities. Bariatric surgery patients, there's that are put on a restrictive diet. In dentistry, we don't know anything about nutrition and the soft diets that we recommend for patients post-surgery. And so I lecture on that to dentists around the country. So there is opportunity. I can see this as being versatile in many different ways to fit many different lifestyles. What I'm really excited about is the pediatric product actually being very useful for all children because it's worry-free. Because if I'm a mom and I remember, and Elizabeth is a new mom too, and she probably remembers, you know, them taking their first bite. It is something that is worrisome. But if you have a true dissolvable that you know will dissolve in their mouth, it's kind of a game changer. So, and kids actually really like it. So it's it is something that you don't have to worry that they're not going to eat it. So yes, I have thought and dreamt of many things.
I hope this makes it into space someday. That would be great for raising awareness, but also a very cool thing to accomplish. And yes, as a new mom, I actually have given my son, who doesn't have trouble with feeding or swallowing, the meltables here. And it was great to watch his fine motor skills when he tried to pick them up. He was probably around 7 months when he was trying these. And I'm an overly anxious parent, very terrified when it came to feeding real foods. And it was a great option to know that it melted, and having been able to try it myself. I guess I do have a question along that, and feel free to wave this question aside if you'd rather not answer it. If a child were to eat one of these and it were to go down the airway, would it dissolve in the 10 or 12 seconds that you said in the airway? Is there enough moisture there?
I would say it would dissolve even before it hit the airway.
Okay.
I mean, I honestly can't. When I think of, unless I mean, if a child even takes a bunch of them and puts them in their mouth, the quick dissolving nature. So the true beauty of this is, you know how solids require moisture to break it down, like it has to get into it. Because this is an aerated foam, it actually brings moisture to the mouth. If you try it, you will feel that, where did this puree come from? You know, it does bring that moisture to the mouth. So I would basically say it's a timing game. And really, as far as that risk, I would say that it would be puree way before.
Thank you. We have a few questions wondering where they could find the research about the work that was done at the long-term acute care hospital.
Yeah, so that was a DRS poster, and we're in the middle of essentially writing the paper on that. The writing of the paper is largely being taken care of by Dr. Schoon and Katja Bruno. So when that is ready, it will, if you know publication process time, it's going to take a while. But I wonder if there's access to posters at DRS. I can tell you, actually, if you go to my website and you go to the resources, you will see all the research that we've done to date, and you will see some nice bibliographies from presentations that I've given that really summarize things related to dissolvable solids. So it will give you a nice round view. And if I can just say, Elizabeth, I have presented for NFOSD in the past. I think it's available on library, some of those presentations that are very much so research focused. It doesn't include the LTAC study, but other earlier research that we've done, yes, it does have that.
Perfect. Excellent. Well, I think we made it through just about all of our questions. There's a couple that I think we did not get to, but I will send you the list of those. And if you'd like to respond, you are certainly welcome to do that. If you think of extra questions, audience members who have joined us tonight, please feel free to email us. We can forward those on or reach out to Reva directly with any questions that you have. Again, there's this promo code here, NFOSD, if you're interested in purchasing anything. And Arwen will contact you with more details here as the raffle winner for that. But Reva, thank you for being our first person to participate.
I enjoyed it. Thank you so much. I never get to share this aspect of Savorease, so the journey was really fun to kind of stay close to the product and the journey, and I really appreciate that opportunity.
Absolutely. Thanks for joining us. We have another Meet the Makers presentation coming up next month. It will be on Tuesday, March 7th. True Angle is the name of the company that will be presenting. Dr. Gabby Constantinescu, will be presenting on a device called the Mobility. So it's a dysphagia rehab biofeedback device. We'll send out more information about that in the next day or two. And with that, we'll wrap up for this evening. Reva, thank you for presenting. Thank you, everybody, for joining us, and we hope you come back next month. All right, take care.